Good morning, everyone. We're so excited to have you join us today, and we really appreciate you taking time out of your morning to join us and learn a little bit more about health and wellness in schools. Specifically, we're going to chat today about integrating health and wellness into a school improvement plan. My name is Christy Cox. I am the Training and Program Manager for Healthy Schools campaign. And today we have three panelists joining us to share ideas and strategies on how to integrate health and wellness into the school. We will be chatting today with Rosa Ramirez-Richter. And Rosa is with Healthy Schools campaign. She's a program manager. We also will have Tara DiClemente. Tara is with the Office of Student Health and Wellness. And then we have Mr. Dana Butler, who is a CPS principal at Ruiz Elementary. The webinar today will run for about 1 hour. We will record the webinar and make this available online. So if you have to drop off early or you have someone who was interested in participating but weren't able to, we will post a recording. And then we'll have a brief survey at the end that'll take about a minute. If you wouldn't mind sharing some feedback, we'd really appreciate it. We'll also have a Q&A session for the last 10 minutes. And on the right-hand side of your screen, you should see the option for chat. So although you won't be able to speak or verbally ask your questions, you can chat those questions, and we'll read them off and then allow the panelists to answer those questions. Again, we have Rosa Ramirez-Richter, Tara DiClemente, and Dana Butler. So without further ado, I want to go ahead and introduce Rosa, who's going to talk to us a little bit about Healthy Schools campaign.
Good morning. Just a quick, short snippet about Healthy Schools campaign. We're the organization organizing the webinar today, and we are a local nonprofit that's been dedicated to working here in Chicago for the last 12 or so years, and our work takes us at the local, state, and national level, and we're really rooted in the common sense notion that healthy students are better learners. And we work at the school level, at the policy level, to really enact that healthy change where students can get access to healthy eating, physical activity, school health services, and and mental health services that they need. Next slide. Next slide. So really what we wanted to do was kick off this webinar by really setting the tone for what we're doing. And we know that healthy, active, and well-nourished children are more likely to attend school, be ready to learn, and stay engaged in class. And while this link is obviously intuitive to many teachers and education leaders who see the effects of non-academic barriers to learning on a daily basis, there's often a disconnect when it comes to incorporating these sentiments and this knowledge that we know into the school improvement planning process. And what you see here on the screen is actually a body of research by a professor at Columbia University named Charles Bosch, and he's really dedicated his profession to really linking the missing link in schools to close the achievement gap. And he really says, until we address the health disparities that many low-income and students of color face, learning disparities will persist. Basically saying that we need to address the health and wellness of our students in our schools in order to help them be successful. Next slide. And obviously one of the ways that health obviously impacts our students is attendance, and chronic absenteeism is largely due to unmanaged chronic health conditions. And data shows that children, and one of the main factors of chronic absenteeism is obesity that leads to sparking off a whole host of unmanaged health conditions. And so children with obesity do miss more days of school. And just to be clear, missing just 2 days of school per month means a student is chronically absent. So that's missing 10% or more school days for any reason, excused or unexcused, it doesn't matter. And these rates of chronic absenteeism are highest among our students that come from low-income families and from communities of color and those with disabilities. So again, going back to, that healthy students are better learners, and what that means is these students are well-nourished, They have access to physical activity. They are ready to learn and stay engaged in class. And so what do we mean by that? So a healthy school environment really means about access to healthy school food, having daily physical education or access to physical activity, access to school health services from, dental visits, vision services, and to having that programming in the school where they're getting nutrition education, learning about what's good for the body, what's good to be eating, how do you move, how physical activity impacts us, and of course, family and community engagement too. So just because this is a really short 1-hour webinar, we won't go into all of these, but I did want to highlight 2 areas where, this might make sense, but tangibly, how does this happen in the everyday school environment? Next slide. So on this slide, you see just different nutrition practices and then the related academic achievement outcomes. So one big one as a school principal, as a school leader, is really promoting the breakfast in the classroom program or school breakfast. And this there's evidence to show this reduces absenteeism, it improves cognitive performance, and it really does increase academic grades and standardized test scores. And then there's a whole host, like even things like that we wouldn't have thought of, scheduling recess before lunch. It increases the consumption of meals, and that also leads to less behavioral problems on the playground, but also during the school day. And from there on, you can go and read it yourself, and we have resources on our website that will go into each of these practices. So next slide. And then the next area is really around physical activity, like what can we do during the school day that will have this academic achievement outcome? And so we know that students who are physically active have better grades, better school attendance, better classroom behavior. So even, neuroscience tells us that once students have been sitting for 60 to 90 minutes, their brains are less able to focus in class. And so we need physical activity to increase that brain function, reduce disciplinary problems, and that leads students to be set up for success. And it also ensures students that have that opportunity to be physically active. And, this is just another key strategy for supporting student attendance and learning. Next slide. So again, the emphasis of this webinar is that, school improvement plans provide a systematic opportunity to address the needs of the whole child by incorporating physical, social, emotional, and behavioral health priorities into schools. And so while we're, going to be launching into the school improvement planning process here in Chicago with Chicago Public Schools, just taking a minute to really think about how we can address the needs of the whole child. We'll stop here. The next slide, and really what our next 2 speakers will speak to is really to help you as a school principal or school leader successfully incorporate health and wellness into your school improvement plan. And so we set up really just 4 steps to try to do that. Is that 1, you need an inclusive team. You need to include health and wellness data in this process, obviously keeping root causes in mind and finding what works in school. And so our slides are a little lagged right now, but in our next slide, you'll see resources to multiple resources on our website, but one including a toolkit for schools that follow these 4 tips to successfully incorporating health and wellness into your school improvement plan. So here are the links. And without further ado, we're going to hand it over to Tara DeClemente at Chicago Public Schools. Also, if you have questions that come up throughout the presentation, again, remember to use the chat function. We're going to launch a poll right now while we get Tara set up for her presentation. So the poll is asking, how do you currently support the health and wellness of your students? So select all that apply. And if there's another one, select other and use the chat function to tell us. And so while you're doing that, we do want to welcome our very good friend, Tara De Clemente at the Office of Student Health and Wellness at Chicago Public Schools. She has been instrumental in leading healthy changes at the district and at the school level, from creating healthier school meals to increasing access to school health services. So thank you, Tara, for joining us today. We're going to do 2 more seconds while people fill out the poll, and we're going to close it. Okay, so a good amount are already providing programming at their school that promotes healthy eating and physical activity. It's really great to see that you guys are promoting the school meals. Great, thank you for sharing. Tara, it's all yours.
All right, thank you. So today I'll really just be expanding upon Rosa's wonderful introduction, and then Principal Butler, we're going to take this show on the road. This is the second time we've sort of presented on this topic. But for those of you logging in who are not at CPS, really just think about how you can do these similar things in your district. And I'm going to focus a lot on how to use data to make your goals, and figuring out where that data is housed will be very important for figuring out how to make your goals within your plan. So you can go to my first slide, past the title, just go to the org chart. So I will start by giving an overview of the Office of Student Health and Wellness, and we are broken into 4 different teams. My team is the health promotion team, so a lot of what Rosa just introduced is housed within my team, and that's with recess, PE and health education newly is in teaching and learning, but we're doing a joint collaboration on that. So for those CPS principals, we do have PE staff back at the district that is ready and willing to help you implement the policy. So that's something new and exciting to share. But we also work on our Learn Well initiative, which is the wellness policies, fundraising, healthy celebrations, and then we also do school gardens, nutrition education, and a lot of the school food promotion. However, I'd be remiss to not promote the rest of our department. We also do the health services, which looks like about half of you are already doing. And then new within the past year is that we've recommitted to helping families enroll in public benefits. And so our team is ever growing with that initiative. And so if that's something your school needs, we can also help with that. Next slide. I won't read all of these mini missions, we call them, but really wanted to focus on the health promotion mission, not just because it's my team, but because it really gets to the root of what we're talking about here today. And it's that we are creating a culture. We are making these are big changes that we're making. And of course, we are an academic institution first and foremost, but really many of the other basic needs of the child are falling to schools. We see students the most during the day, and then for the longest time, a lot of parents and guardians are working and busy and always running around, and so we're really helping those families to meet these basic needs. And so when you're thinking about working on your plan, think about that this is a culture shift. And while we have academic outcomes and tardy and absenteeism and all these very academic focused initiatives, that there's a lot of health and wellness related to those goals. Next slide. Here at CPS, for those logging on outside of the district, we do have our Healthy CPS indicator, which is on the report card. All of you received your reports, and those will be going live within the next few weeks. We're a little delayed here at the district, a few internal hiccups, but these will be going up, and this really helps us to show the community and parents what each of the schools is doing to help to support the needs of the whole child, as we like to say, and those include chronic disease, instruction, learn well, and health services. Next slide. And then this is just one of our great resources that shows really easy how to get started on your journey to Healthy CPS. And we have this available in PDF as well as printed handouts. So if this is something you're looking to share in your wellness team, in your MTSS team, in all of those, the wonderful teams that are established at schools that we recognize every department here asks the school to nominate a champion or create a team. And we really would like you to see that health and wellness folds into a lot of the work that you're already doing with academics. And I think Rosa made a great point of that with just the 4 first steps. Next slide. And then next slide. So there's really two main ways to write your plan and to incorporate health and wellness. So of course, for our office, the gold standard would be that you would have health and wellness as a standalone strategy. And that would show that you are 100% committed to focusing on one of the areas of health and wellness as one of your steps in school improvement. So these are two very high-level goals that you could incorporate, and we could truly go through any aspect of the Healthy CPS policies and initiatives to make these. But just some examples that we thought of here was, if we do daily physical education, then we will see more attentive students and less behavioral issues, which leads to increased academic success. So really taking a lot of what Rosa showed you and just turning it into that sentence that the CIWP team is looking for within your plans. Another example could be, if we do comprehensive health education, then we will see students making healthy decisions around food, physical activity, sexual health, and chronic disease management, which leads to increased attendance, attention, and academic success. So again, I think that Rosa's first slides would be really helpful for you in writing these standalone strategies if that's something that you're interested in. We, of course, recognize in our department that there's also a lot of strategies that you are required to include in your plan based on your attendance rates or based on your network chief and sort of the direction of where they are telling you to go. So if you already have your goals are totally full and you can't think of adding another standalone strategy, then the next slide really will show you how to tag health and wellness as part of a strategy. So let's say, you're maxed out, you have your goals in your plan, but you really do want to tag health and wellness as part of your plan. First and foremost, there are the available tags within the document. So you can put PE, physical education, as a tag, and we would encourage you to think about that if you're making health education goals as well. And there's a student health and wellness tag. And then we have a guidance document. So that's the logistical as you're going through the plan, what you can hit those tags. But then the next few bullets show some examples of, we have gone through each of the SEF strategies or each of the categories, and we have given some bullet points for things you may want to incorporate if it's one of the areas you're working on. So if you've chosen attendance, then we want you to note that attendance is highly linked to chronic conditions. So that's students with asthma, diabetes, and food allergy. And especially if you, think of the students with chronic conditions. All of us know an adult who's not managing their diabetes very well or their asthma, and they're always out sick from work, or they're always sick, or they're in the hospital, they're at the doctor. This is the same thing happening to our students. And we've definitely found, we'll go into where to find the data, but we have found that on average, our students with chronic conditions are missing at least 2 times as much school as students without chronic conditions, if not more. So then we also pulled out within family and community engagement. We know that this is an area that schools are really working on. Being transparent, the district is really working on this. It's definitely an area that we are a bit behind on in terms of where we are in progress in other areas. But knowing that a key way to engage family and the surrounding community is around health and around food and around helping them to fill a gap or a challenge that they're experiencing at home. So many families send their students to school and turn in those paperwork for the dentist and for vision and to get eyeglasses, because at home, they're not even sure where to begin. Maybe they don't have health insurance themselves. They didn't grow up going to doctors for well checks, so the idea of having a primary care physician is something new. We have families with some undocumented family members, and they're not sure how to get their children the health care that they need, and there's definitely heightened fear around being undocumented. So this is a way where schools can bridge the gap, bring families in, and we can really help on that. And you can list those, of course, within your strategies, that you'll have a health fair, you'll have a benefit enrollment event, et cetera. And then, of course, MTSS, which ebbs and flows within intensity or popularity within the district, but has really remained a constant over the past few years. MTSS to us is exactly what it means to educate the whole child, because it's different levels of support. So when you think of in public health, there's tier 1 and tier 2 interventions, not to get too professorial here, but tier 1 is what everybody gets, and then tier 2 is intense, and tier 3 is more intense. It's exactly the framework of MTSS, and we really see a lot of health and wellness as that tier 1 support. All students can have glasses if they need it. All students can hear. All students can eat. And all students can go to the doctor when they're sick. And so thinking of how health and wellness goes into that, and so as you're writing your plan. Next slide. And then next slide. So now I want to go into dashboard. So dashboard here is, in Chicago Public Schools, is where all of the health and wellness data is housed. And every single school has their own dashboard, and then the district has their own dashboard. So why we think dashboard is so exciting is because it's all of the data that you would ever need to prove the point of why health and wellness is so important, and especially in an academic institution. So we have really just these very high-level goals of how we would like dashboard to be used, but like I said, fundamentally, it's that you can have the health data available to you. Then you can figure out, based on all of the data, what academic improvements can happen or outcomes can be impacted based on the data in there. You can really look at that. You can look at your school level data, and you can look at your student level health data. And then that way, you can figure out which staff may need more training based on where students are in the building, or just sort of what other interventions you may need. And then, of course, as you're doing your MTSS team, your SDLS team, all the teams that, the health and wellness team, all of them that are working on in these improvements, you can really make data-driven decisions, which is a particularly important way to go right now, especially under Dr. Jackson. She's very interested in making data-driven decisions, and so this is exactly what you need when you're making your plan. Next slide. So these next slides, and I will actually, Rosa, send you a longer presentation that has all of the examples. I don't want to go through all of the data that's available because I could take the rest of the time, but this is just a sort of quick how-to. I've deleted a couple of slides, so Rosa, I'll send the other step-by-steps. But next slide, this is where you can find dashboard. And then on the next slide, it shows you dashboard definitions. And it very clearly, you can see, you know, asthma, diabetes, allergies, et cetera, and it will define what you're looking at. Then you see under all of the categories, you hit safe climate. Next slide. And then there we are, health and wellness. And so within the health and wellness dashboard, here are the categories that you can find out more about. So physicals and immunizations, this is probably something you look at the most that actually our office doesn't oversee, but we help with. It's more in diverse learners with immunizations, but it's really not important. We can help you with that as well. And then chronic conditions, dental, vision, hearing, and sexually transmitted infections. So it's important to note that STIs are not student level. That would be breaking a lot of privacy, but it at least can tell you by network level, so you can recognize, is your school in an area with higher rates of STIs, and we have so many wonderful sexual health interventions, services, education, safe and supportive environments can really help you with that. So as you see on this slide, there's chronic conditions. So next slide, and then again, past the title. This will really go into what you're looking at. So, perfect. When you go into dashboard and you click chronic conditions, I've obviously covered student names here to not be telling anyone's medical information. But the great thing is you can go to your school and says, okay, 5% of your students have a chronic condition, 3.7 are with asthma, less than 1 is allergy, and then how many with diabetes. So it tells you how many students should have a 504. You would be able then to compare, let's say this is your school, it says 26 have a 504 needed, and you only have 2 students with a 504 on file. That can help you meet that need, but as far as your plan, you can then go in and say, okay, each of these students has this chronic condition. So then next slide, you can start looking at their attendance. And so you can do, again, individual or by chronic condition. So you could see that within your school building, students with allergies are 90%, asthma 94%, et cetera. But then you can see your students with no chronic conditions have the highest attendance. And so when attendance is one of your goals, linking it to better management of chronic conditions, better training of staff in your school, better training of families, medical enrollment, et cetera, this is where you can use this data to figure out what is the true need within your school. Next slide. I always skip and tell you what I'm trying to tell you before I get to these summary slides, but exactly what I just said really helps you with that eligibility need. But really working on attendance, we just cannot drive home enough. You all know as leaders in your building that attendance is just so vital, and such the sort of simplest barrier to academic achievement is just getting a child to come to school every day. Simple in air quotes, because it's not simple, but if we can help with the chronic conditions, then we know we can at least get those students some better attendance. Next slide. Next slide. So similarly with vision, I wanted to go through to just show you what you can see. So, and like I said, I have more slides that go through each of them with dental, STI, et cetera, but I just really want to show chronic conditions and vision because to us, these are where we see the biggest improvements. We have so many students who get all the way to high school. This is a student who's not doing well. They have just been that student that's just been sort of just gets by, graduates, each grade to the next, but doesn't see a lot of improvement. And they get to high school, they get their first vision screening, they have glasses, and they're an A+ student. And it's just thinking of what could have been had that student had glasses from the day that they needed them. So what's great about this information is, again, as you're thinking of academic improvement and your plan, how do you make sure all the students can see? So you go onto this slide and it'll show you who's been screened, how many compliant with all of the requirements, who needs case management, the first screening that's required, second screening, vision exam, and who needs glasses. So then next slide. When you use that data, you can go through and see, okay, 102 students need glasses. Well, how many of them have gotten the glasses? How many of them do you know never wear glasses? And so you can really be working with the teachers to say, hey, here's the list of students in your class who are supposed to be wearing glasses. And the teacher can help to troubleshoot that. We do offer 1 pair of free eyeglasses a year and then 1 replacement pair. So up to 2 pairs. So if a student is able to get glasses through us and then loses them or breaks them, because we know they're children and these are fragile pieces of medical equipment, that we will also replace that. And then we have vision and hearing technicians that come out to schools to do screenings, but then we also have a vision clinic with comprehensive eye care. And that can really help too if students have visual disorders. So, the students who are beyond just glasses. that need a little more intervention, we can help with that. Next slide. So then I just did want to, next slide, final, promotion of all of the information we have available to you. But then, of course, I really want to highlight the, Office of Student Health and Wellness Technical Assistance. This is why I think our office is so unique, is that we are very attuned to coming out to schools, meeting with you, going through this data with you to really help you make your plan. And so if you need anything, we of course have it on the Knowledge Center, we have it on our public website, and we have all of our plans and toolkits, but we of course are first and foremost available to you by phone, email, or in person. You also can subscribe to our digest, where we are starting to incorporate a parent corner, so tips for parent wellness. So that's something, if you have a parent web mailing or newsletter, you can just copy paste, send directly out. And we also do put in some grant opportunities, and we are looking to partner with some of our external organizations to start doing some staff wellness. So we'll be having a staff wellness corner as well. And then the final slide is just my information. So thank you.
Thanks so much, Tara. That was such a great presentation. Again, remember, you can use the chat function to ask questions or comments that you might have about the presentation. So while we get Mr. Dana Butler's presentation up and ready, we wanted to ask the group, from what you heard so far, what health and wellness strategy are you likely to include in your school improvement plan? And you can chat us a few different answers, or if you're not sure, just say not sure. So while we're doing that, in the meantime, we are very fortunate to have our very good friend, Principal Dana Butler. He's the principal at Irma C. Ruiz Elementary, and also just a veteran education leader in the district and across the country. He was one of our very first pioneer principals to really embrace health and wellness, and really has championed this cause personally, but also just throughout his work, and it's really evident in his passion. So we're very lucky to have him on today. And without further ado, we'll pass it on to Dana. Dana, thank you so much.
Good morning and buenos dias to everyone, and thanks for everyone who has called in. Obviously, this is a very, very, very important thing to talk about with our kids when we speak to educating the whole child. And I had the pleasure of speaking with Tara earlier in the summer at the Principals Institute, and some of these are some of my same thoughts at that time, with some wonderful adjustments. Just a little bit about Irma C. Ruiz. Only female officer killed on the line of duty, protecting students. So all of the things that we do, we honor and support her, and we hope that we're always being ambassadors for her wonderful name. So I always have to say that. Next slide. So in the real world of technology, when you had clicked to that, this video clip would have automatically started of students dancing. But we talk about, when we talk about the whole child, we're speaking to how you're incorporating health and fitness and the content areas, math, language arts, looking at cultures through social science, the social emotional learning component, as well as the arts, equaling that whole child. It would have been a cool clip, but you would have seen them doing the Paso Doble. And maybe when they send this out there, maybe I'll send the actual clip there. May I Have This Dance? This is just one of the many cooperative partners that we have, and community-based organizations that help to support healthy schools and a healthy child. Next slide. This is when we had an opportunity to go with the Go for the Goal. We were one of the schools selected to visit the White House with our former First Lady Michelle Obama when there was a major initiative regarding obesity for our students. And this is one of our fitness champions. Deborah Zigowitz is one of our physical education and health instructors here. 29 years in the system, so she's most certainly been vested in this. Next slide. This is also a video clip where you would have seen kids actually working in the kitchen. Common Threads is a program that helps kids to start to learn about nutrition, portions of food, salt and sugar content at the ripe early age of 4th grade. We also have a program, Small Bites, through Common Threads with Maddie Burns as our go-to person there, as well as Chef Aleka, where the students actually get to incorporate learning about cooking, but through the content areas of science and health and math with portions. So we really are talking about trying to incorporate and not make looking at health and breakfast and recess separate entities. They all are important content, and really making sure that those kids are feeling good about coming to school. They're not lethargic, and they're at their best for assessments and showing what they know. Next slide. A couple of other examples, and the reason I'm showing the examples is because if you're trying to help to adjust, change, reflect on the climate and culture of a school, you have to find many levers and many bridges to address some of those entities, and you have to try to reach every child that you can from pre-K to 8th grade. The picture at the top is when we were running in this incredibly horrid weather a Saturday ago with the girls on the run. That one speaks to staying healthy and active, but that one also as bonding and making sure that even young girls know that they have their place and their voice. The picture to the left is at one of the competitions for Dancing with Class, where not only is the dancing part very important for the healthy part of it, but the social motion. When the students go up, they have to say, "May I have this dance?" And they have to make eye contact, so boys and girls learn very appropriate ways to communicate with each other. And great program, Margot Toppin. And I'm not name dropping. What I will be telling you is that when you are looking to help and continue to change, you have to find people who are going to support you, and they're going to be advocates for you. Derek Young from CBS, who came out on his own to make sure to film The Dance Makers Are Peacemakers. Dancing, people exercising in very rigorous time, but more so about how we address problems and concerns in the world. The picture to the right, Amate Ora, it's a local organization by Leticia Madrigal, who gives students an opportunity to speak at health fairs. These are students from our school that came and talked about heart illness and how you can make sure to keep up with your diabetes or how you can check your blood. And these students are part of a 5+1 program that I'll talk about a little bit later, how the students are learning how to do those at an early age. Next slide. Another picture of a fortuitous, and it was raining pretty good out there, but we certainly did our best. Next slide. Here's another opportunity in your school. We do what's called a Polar Express, where the kids talk about and learn about this culture, and they write about it, and we actually take this through the school. We actually march through the school. So any opportunity where you can look at health and fitness, but also incorporate it in with the content areas and the things that we're doing from the academic side it's a great mix So these are just some of the fundraising and activities that we have made adjustments to. I'll just kind of scan through them really quick. Having 7th, 8th grade spring performances, we've gone from more candy sales and those types of things to move-a-thons, dance-a-thons, walk-a-thons, things that are more health-related and health-based for fundraising. Even our 8th grade trip is about team building and physical activity. We also obviously have pre-K through 8th grade health and physical education classes for our students. Healthy Schools Campaign, the Fit to Learn program, where they come out and help our teachers. And once again, not name dropping, the Healthy Schools Campaign team, they are beyond fabulous, and they're such a great support for Chicago Public Schools, so I most certainly applaud them as well. Intramural basketball, volleyball, Laps for Learning, Steps for Science. The program that I spoke to earlier was about the 5 + 1 + 1 = 20. Based on statistics and data in the Pilsen area, lives are cut short by the number of about 20 years, and we hope that the 5 + 1 + 1 program, where students are actually learning about obesity and learning about, and they're actually doing blood screenings and checking blood pressures and learning so much about it that they're reaching out to at least 10 of their own family. Currently, we have 30 students in the program, so we hope to redirect or get to the doctor or pay more attention or more activity to 300 of our families and 300 parents, kids, and families in our neighborhood. St. Anthony's another great support, and we said Girls on the Run as well. Next slide, and this is another one, just kind of going through. I've mentioned almost all of those. This is another one where there's a little video where the kids talk about portions and show you their culinary skills as well. Next slide. And next steps. And this is probably the most important slide of all. As applicable, please use your data to help to guide you, whatever it is. If you're seeing that your attendance is starting to go down or it's decreasing, as Tara said, you're checking to see, are there chronic conditions? Are there asthmatic things happening there? Doing your research and looking and trying to know all of our individual kids. Make sure that your budgets and your CIWP reflect that. It is an important cog in some form or facet, because it's easy to say it, but if there's not any monies or things assigned to it, and getting councils and teachers and staff and all stakeholders involved in that thing means it is important. Celebrate every opportunity that you have and share those successes out there. That's why I put some of these many, many things that the kids are doing out there and they're very, very proud of. Create a month-by-month calendar, or something that you feel that is important to you, whether it's going to be, we're going to look at dental care, or we're going to look at cutting back on sweets. Everything is still moderation. You're still going to have a birthday cake. You're still going to have some of those things, but it's how you can moderate them, how the kids and the adults are paying much more attention to what they are doing. But if you actually put it in place and get action items to them, and you can go back and reflect and see whether you made some movement, that's another huge one, which goes into the effective monitoring system. And include parts in your CIWP. Really have those parts there that are important for your school. Invite, encourage, recruit, develop, and support your own health wellness team. When it's really, really rocking, you have students, you have the community-based organizations, you have your staff, you have your career service, you even have community people. Because if you're walking in and you're modeling and practicing and reflecting it, it most certainly will have a greater impact on your school. And that's my story. I'm sticking to it. I also want to make sure that I mentioned our Network 7. We have a great support there with our Chief Minerva Garcia Sanchez, our Deputy Chief Rick Johnson, and our SEO Michelle Jackson. They really, really help to support us on all of our endeavors towards this. Thank you.
Thank you so much, Mr. Butler. You gave a lot of great examples on how health and wellness is a focus at your school and what other schools can do to make that a priority as well. We have a little bit of time left over for questions for the panelists. And so, again, if you could chat your questions on the right-hand side of the screen, there's an option for chatting. So just type in your questions, and we'll start throwing them out to our panelists. We do have one question that already came in. The first one is for Tara. The question is, do you help pair schools with partners around healthy eating and or physical activity?
Yeah, great question. We do. The short answer. The long answer is that we actually just finished a partner survey where we found out where all of our partners are within schools, to just make sure that there's also some equity in that, because there are some schools with a lot of partners while still some are not aware. And so we do try to look at the healthy CPS data, the data of where partners are, and to match them up. Yes.
Thank you so much. This question is for Mr. Butler. What tips can you provide for parent engagement? So could you just talk a little bit about how you engage parents at your school?
Well, a starting point would be kind of any type of survey, because it also will provide you some type of data, some type of survey that says, what do you think is important for, for your kids in the school around health and nutrition, around lunch food, being able to read that menu, find out what is important for them. And once people have an opportunity for some voice, and then you can actually see movement, then you can get more and more parent engagement. Make it a part of your LSC principals report or agenda, or sign up to speak, to be able to speak to a part of the nutrition or the health that you would like to make a impact on. Go to your BACs and bilingual advisory committees and parent advisory committee meetings, and that's where I think it's as much as people can get a chance to share what it is that they'd like to be a part of. Maybe they're a runner. Maybe they'd like to say, well, if you have a group that runs, I can be a person who runs with them. So any way that you can feel like that you can help always is great impact.
Tara, another question came through. Do you have a CIWP guidance tool on the Knowledge Center?
I do think it's on the Knowledge Center. It's a really good question. If it's not, I will make sure it's up there today. But we do have a guidance document available, and so I can make sure that I send it to Rosa and Christy to send that after this, and I will make sure it's on the Knowledge Center if it's not.
We also have information on our website at Healthy Schools Campaign. There's a lot of tools and resources available. You just have to search the website under resources, and there's a lot of great tools there available for parents and teachers and principals. And so we certainly encourage everyone to check that out and download and share all the resources we've made available. Healthy Schools Campaign is committed to improving the health and wellness of Chicago schools and our students, and we are just so thankful to have a great partnership with both Mr. Butler and Tara DiClemente. Specifically, the Office of Student Health and Wellness has been such a great support for schools and partners. And then, of course, Mr. Butler is leading by example every day in schools, and we love to prop him up as a shining example of what principals can do to help student improvement. Those are the questions we've received. So we're about 10 minutes early, but I don't think anybody's going to complain about getting off of an hour-long webinar. As you can see on your screen, these are this is how you can get a hold of Rosa, Tara, or Mr. Butler. So please feel free to shoot an email to the three. Again, my name is Christy Cox, and on behalf of Healthy Schools Campaign and CPS, we want to thank you so much for spending your time with us today, and best of luck to everyone on your pursuit of healthy students. Have a wonderful afternoon. Thanks so much.